Hello everybody. I wanted to talk to you. There's a question that comes up often enough that I thought I should address it. And typically the patient calls me the next day and they're concerned because I didn't write them for any antibiotics. There was nothing on their prescription. And so the question is, for elective cosmetic surgery, are antibiotics after surgery indicated? And so there's been a great push over the past 10 years for what's called evidence-based medicine. That means that our decisions, and I agree with this, should be based on scientific data. Not just because this is our gut feeling or that makes us feel better, right? That's not really medicine. So what our society has done is they've looked at all the data for all the procedures, they've looked at all the research. This involves usually 30 or 40 year span of data, tens of thousands of people. And so the short answer is there is no indication to give antibiotics after elective cosmetic surgery. The risk of infection was the same, whether the patients got antibiotics or not. To clarify some things though, we do give antibiotics before surgery in certain procedures. For example, if a patient is going to get any kind of implant, breast, for example, breast augmentation, chin augmentation, buttock augmentation, even let's say the patient is reconstructive surgery and they're getting rib from their own body, we do, there's data to show that antibiotics before surgery helps. And there are certain guidelines with the dosages and we follow those guidelines. But the question is, well, just give antibiotics. What's the big deal? Well, it is a big deal. First of all, some patients develop diarrhea after surgery. Some of my patients have gotten yeast infections. But the worst thing to do is to just give antibiotics like candy. Bacteria mutate because they're very simple organisms. And what happens is some of these mutations cause drug resistance. So if the antibiotics are just given, to everybody, we're essentially creating more resistant bacteria. And so when there is an infection, the chance of getting better is going to be worse, and the patient may end up in the hospital. And we're seeing that with sexually transmitted diseases now, since Tinder and Grindr, and I'm sure there are other websites out there, have come up, and the rate of casual sex with strangers have gone up. And the rate of STDs have gone up. Now suddenly there's this emergence of resistance organisms that used to be treatable with what the standard medication was. So, there's really no indication. And like I said, the risk of infection is the same. Well, I think that was helpful information for you. Take care and be safe.